Okay, welcome everyone. I'm Lamecca, Director of the East Flatbush Community Partnership, and you are here for Open Door. So today's agenda is we're going to have some welcome remarks. I'm going to share a little bit about the partnership, some updates, and we have an amazing talk coming up with Dr. Christy Lee, talk on health and diabetes. As usual, we're going to have our raffle card giveaway, and we're going to close out for the evening. Okay, I need to move some Zoom stuff around because it's blocking me. I can't see. Hold on, guys. Hold on one moment. Okay, we're gonna move that over. Okay, great. So we're gonna start it with our partnership overview. And so we are the East Flatbush Community Partnership, one of 11 partnership. We are funded by ACS. And I just always like to describe it as we are a hub. So when families are in need of resources, whether it be housing, employment, education, medical, references to doctors, health insurance, things like that, they will come to us and then we will connect them with our network. We don't provide direct services, but we do have a large network of service providers. And we also have a lot of community events throughout the year. And so what you see on the screen right now is we have our monthly meeting that happens the fourth Thursday of every month from 3 to 5. That is a hybrid meeting, and we always encourage people to join us in person. And so this month, we're actually going to be at the Rugby Library, and we're going to be there for the entire summer. Okay. And the next slide that you see there is for where we are now, our virtual open door meeting that happens the second Thursday of each month at 7 p.m. We have two upcoming events that we'd like to share with you. Both are a Men's Street Appreciation, but they're going to be held at two different locations. The one on March 14th is going to be held at Marcy Plaza, and the one on the 21st is going to be held at the Halal Plaza. At these events, we are going to honor men in our community. They're going to receive resources, complimentary haircuts, health screenings, and lots of free giveaways. So we encourage you to invite brother, uncle, nephew, cousin, father, grandpa, invite them. We want to love up on them and let them know how much we appreciate them. And then we also have another event that's happening on June 23rd. That's going to be from 11 to 12:30. And this event is going to focus on rights for immigrants. And we're going to be providing some valuable information that will help them navigate what's currently going on in our world today. That's going to be held at actually, that one's going to be on Zoom, and the link is there. You can also scan the QR code. Okay. So there's gonna be I'm seeing okay. So I'm seeing two different dates. Yeah, I see the
Yeah,
23rd and the 25th. Okay.
yeah, you
I think the
are. One
23rd
is
is
on
the
a
right one.
Wednesday.
I think the 23rd is the right one because that one's on the flyer. Okay. All right.
I think it's because it's different languages, so different dates.
Let me see. Okay, that's see because Zoom is hiding a whole lot of stuff. I can't see. You're right. So hey, thank you. The Haitian Creole one is going to be on the 25th, and the English speakers one is going to be on the 23rd. Thank you so much, Stacy. Appreciate you.
You're welcome.
All right. So now I'm going to present our honored guest. Dr. Christy Lee is an internal medicine resident physician at Brooklyn NYU Langone Health Hospital. And today we're going to be hearing all about health and diabetes. So I am going to bring Dr. Christy Lee up. Thank you for joining us today. Appreciate you.
Thank you for the introduction, Lamecca. I'm going to share my screen and just let me know if you guys can see it, okay? Give me 1 second.
Yes, we can see it.
You're able to see it?
Yes.
Perfect. Okay, so I know I'm giving a talk on health and diabetes, but I want to make this a little bit more interactive. So in any time, if you have any questions, like feel free to like raise your hand or just speak up so that, it can be more interactive rather than me just talking for the next 30-40 minutes. But our talk today will be mainly on the essentials of diabetes. I'm Dr. Christy Lee. Some of the topics that we'll be going over, it will start with the fundamentals on what is diabetes, the types of diabetes, the symptoms that you'll be noticing, and the diagnosis, along with management and risk factors and how to lower them. And we'll end up with summary and additional Q&As. And also, if I'm talking too fast, just tell me to slow down and I will. First of all, what is diabetes? You may be familiar with it. You hear the word diabetes all the time, but I'm going to give you like a scientific description, like the mechanism behind in medicine. So when we eat food, you see this picture with the bread going in. Our organ called pancreas makes something called insulin because without the insulin, our body cannot, our muscles, our different organs cannot extract that glucose that is like broken down into usage. So if that is not being used in our bloodstream, you will have a lot of glucose. So in normal blood glucose, there will only be like not too high because the insulin would have already absorbed it to our muscles and other tissues because that's the insulin's job. But if the insulin is not working correctly in our bloodstream, we'll have more than what is necessary amount of glucose. So then there are different types of diabetes. Like I said, for a healthy patient, the pancreas will be making the insulin, which can now have like help in absorbing that glucose into the muscles and be used in other parts of the body. But in type 1 diabetes, we have a problem with the production. So then the pancreas is not making insulin, and therefore our bodies cannot use it. And type 2 diabetes is that while the pancreas is making the insulin, our body's resistant. So then it's not being worked. It's not being effective in absorbing that glucose. So while the insulin is still being made, it's not being effective at use, and we call that insulin resistance when there's like resistance before getting it to be used. So more about type 1 and type 2 diabetes. Type 1, besides the body not making enough insulin, it is usually caused by immune system reaction with your body not making appropriately, and it usually often starts in childhood. So you'll see like at a younger age, and symptoms come on quickly. So at an early age, the symptoms will be very obvious. And for those patients, insulin injections will be the way because they don't have insulin to even work with. Whereas type 2 diabetes, it's the body not responding to insulin. There's that resistance. And lifestyle factors and genetics usually contribute to it, and it's more common in middle age. And symptoms develop slowly. So it's not like when you're like 5 years, 10 years old, but it's more like 40s and 50s and 60s with other risk factors and lifestyle modifications that will lead to diabetes. So type 2 is more common than type 1. Next, some of the symptoms that you'll see are that you're having to pee a lot and often at night. And we don't want to confuse this with incontinence, which can happen in elderly patients. This will be like peeing a lot, not only frequently. And because you're peeing a lot, you will often feel very thirsty as well. And without body being able to make a use out of the insulin and use out of like the glucose, it's going to lose a lot of weight without you trying because we're not being able to utilize the energy. Insulin, our body's being resistant. And because of that, you're going to feel very hungry because no matter what you eat, our body's not able to use that and use that as an energy. And you might also experience blurry vision, numbness or tingling in your hands and feet. And that is because with the blood vessels like thicken from too much glucose or sugar in the body, it's not going to get enough like perfusion. And you also feel very tired, your skin might be dry. You'll have like infections or sores that is not healing as fast. So the question, like, do you have diabetes? How is it usually diagnosed? So We usually test this on a fasting blood glucose. So once you wake up in the morning, you haven't had any food, you would test your glucose and see what the level is. And if it's below 100, this is normal. You're doing a good job, and we'll continue with continue with the same lifestyle. But if your glucose level is between 100 to 125, you might be in the pre-diabetes level. And this is a risk for developing type 2 diabetes, and there are steps to prevent it. So at this point, you don't have diabetes, but it's like giving you a warning sign. Hey, your glucose is higher than normal, and that means those glucose, again, is not being absorbed. It's not being used by the insulin, right? Because there's a resistance. And for that, we'll try to lose weight and increase exercise. But again, we'll go in depth in later slides about how to manage those. And if it's 126 or higher, there are other tests that we would do, but it would be considered in the diabetes, and you would then work with your PCP or endocrinologist to control your diabetes. And we will look at the A1C test, we will look at the blood pressure, and we will look at the cholesterol. So now let's talk about the risk factors for diabetes because, if it's genetics, if you had diabetes at a younger age due to like immune system, then there isn't much. But if it's, type 2 diabetes where lifestyle can have a huge effect, then, we want to try as much as we can to prevent having diabetes. And some of the risk factors are being overweight or obese, and that's a significant risk factor. It can lead to insulin resistance. A lot of adipose tissue in your body will not be good, will not be effective in insulin doing its job. And also, like having a parent or sibling with diabetes can increase your risk. And this, it could be that similar lifestyles are being shared, you eat the similar food, similar activity level, but also it could be genetics. And also type 2 diabetes increase with age, especially after 35. So we definitely test their A1C level of patients at the age of 35 or even before if they have risk factors such as being overweight, like family history, things like that. And also PCOS, polycystic ovary syndrome, is associated with insulin resistance and increased risk of type 2 diabetes. And also sedentary lifestyle can increase your risk of diabetes. It would increase insulin resistance and lower glucose utilization because when we're moving, when we're working, exercising, that's when our body, our muscles working to grab those glucose from the bloodstream because that's their energy and they need to use that while exercising, while walking, running, all that. And women with gestational diabetes in pregnancy have a risk of developing type 2 diabetes later in life. So even in pregnancy, it's important to control your diet, what you eat, exercise, and all that because having diabetes during pregnancy can like later on increase your chances even after giving birth. And also with pre-diabetes, if blood sugar level is higher than normal, it often progresses to type 2 diabetes if it's left untreated. So when we have these warning signs of like pre-diabetes, then we want to work on it. We don't want to just leave it just because we're not in the diabetes level. And also like some medications such as glucocorticoids and some like antipsychotic drugs can increase the risk of diabetes because they would tend to increase the glucose level. And if we don't control it, if that's persistent, it can lead on to diabetes. Any questions so far? Perfect. So I'm going to talk about the basic treatment because treatment is very personalized between patients depending on what kind of diabetes they have, how they're feeling, because there are multiple medications and it's not one size fits all. We would give patients based on their side effects and how it's working because not all medications have the same effects. So first, it's the insulin therapy, and this is for people with type 1 diabetes and some with type 2 diabetes. Um, Insulin is a crucial part of treatment because for type 1, they're not making any. Therefore, we need to inject it. It helps the body use glucose for energy and regulate blood sugar levels. And there are several types of insulin available, each with different onset times, peak effects, and duration. And some of them are mixed together. And like the rapid acting insulin, like the name suggests, starts working within 15 minutes, peaks an hour, and lasts for 2 to 4 hours. So then rapid acting or short acting, these you would usually eat, take it with meals because you want to make sure your blood glucose is under control after eating your food. And there's also intermediate acting insulin and long acting insulin that starts to work a few hours after injection and works for about 24 hours or longer. So usually they're injected, once or twice, and it would still stay in your bloodstream. And usually, you may have heard of it like glargine. You take it at night and it would control your glucose throughout the night so that when you wake up, it's still under control. Some for oral medications, it's very common in people with type 2 diabetes. You might have heard metformin, that is very common. And it's often considered first line treatment. So the very first thing that we start for type 2 diabetes. And its mechanism is that it lowers blood glucose by decreasing the amount of glucose produced by the liver. Because the liver temporarily holds the energy source that we don't use immediately, so that anything that we don't use immediately will be stored in the liver for, even up to like 96 hours. And so then metformin would decrease the amount of glucose produced by the liver. And then we have other medications, sulfonylureas that stimulate pancreas to release more insulin. And again, this is for patients with working pancreas. If your pancreas is not working at all, this treatment option wouldn't be right. And there's also called TPP4 inhibitors that helps improve A1C without causing hypoglycemia. There's SGLT2s that increase glucose excretion in the urine and such. But I want to focus today more on the lifestyle changes because medication, you would talk to your primary care doctor, endocrinologist, and it would vary depending on the patient, whereas lifestyle changes are very broad and it can apply to almost everyone. And why should you work on your managing diabetes? Like, why should we just like let it be and like ignore it? And these are several reasons more common than others. Some of the complications with not controlling your A1C and diabetes is that brain strokes can be more common, cerebrovascular disease, neurocognitive impairment, and dementia. And also for your heart, it increases your chances of having cardiovascular disease, hypertension, atherosclerosis, where your blood vessels um, are being clogged. And myocardial infarction is when there's like a rupture in the blood clot and you have a heart attack. So all those events, the chances will be increased with diabetes that's uncontrolled. And also in the kidneys, you can have diabetic nephropathy and renal failure. Again, with the blood vessels filled with glucose and not being controlled. And also diabetic neuropathy when you have like tingling sensation in your hands and your feet. And again, that is when the diabetes is not controlled. And with eyes, diabetic retinopathy, because all our organs have vessels, even eyes, they have the smallest vessels. And if those vessels are, filled with glucose, sugar, and if it's not well controlled, it can lead to blindness. Also increase your risk of cataract, glaucoma, diabetic macular edema. That's why patients with diabetes go see an ophthalmologist, an eye doctor, at least once a year to make sure the disease is not progressing. And then tooth decay, fungal infection, chances are increased, along with peripheral vascular disease, because the vessels get smaller and thinner as we go away from the heart. So like of your feet, of your hands. And that's why you're more prone to get full ulcers, gangrenes, and even amputation. And that's because the vessels in your feet and your hands are small, those would be the first ones to be affected because it would it wouldn't take that long for those vessels to be clogged. And because you're not feeling like the pain or the symptoms in your feet, if it's left untreated later on, you might have to go through amputation. And that's because it's not being appropriately, like the blood circulation isn't going on appropriately. And I know these are very like scary diabetes complications, but what I want to say is that it can be managed. Like once we, take care of ourselves, take the medications, and work on lifestyle changes, we can definitely prevent these complications and their patients with diabetes without any of these complications. So then the lifestyle changes that I want to focus on first would be dietary modification, healthy eating. We want to have a balanced diet that includes a variety of fruits, vegetables, whole grains, lean protein, healthy fats, and also regular physical activity, aiming for at least 150 minutes of moderate intensity aerobic activity per week. Exercise helps your body use insulin more effectively and can lower blood sugar levels. And also weight management. If you're overweight, losing even a small amount of weight can have a significant impact on your blood sugar control. People who are overweight and lose as little as 7% of their body weight can decrease their risk of diabetes by more than 50%. Stress management, finding ways to manage stress through relaxation, techniques, hobbies, or activities that can help you unwind. Quitting smoking can reduce your risk of diabetes-related complications, and limiting alcohol consumption. If you choose to drink, do so in moderation and be aware of how alcohol affects your blood sugar levels, because alcohol surprisingly has a lot of sugar. And those are some like blind sugars that you never thought about that has sugars in them can increase your blood glucose levels. So I want to focus again on like the lifestyle modifications, especially diet. So when we talk about diet, like what food should we eat in order to better control um, like diabetes and control that sugar spike? So this is like a graph showing how your blood glucose would respond to the food you eat, okay? So let's say that you eat like a toast, like piece of toast, white bread, white rice, okay? Then what happens is that those food gets processed very fast, like those refined. I want to think of it this way. The more they are away from being in their like natural state, like going through factories, being refined, dried, like processed, the higher it will spike your glucose level. So it goes up, your sugar goes up. So then your body says, hey, like there's too much sugar, like it's higher than what it should be, and then starts producing insulin. And insulin is what shuttles the sugars into the cells to be used as energy. And when that happens, your glucose drops. But it doesn't drop immediately. It like drops like that bomb, and then you would crash. And this is when you sometimes like feel sleepy, you feel tired, like lethargic after like a huge carb, lunch or dinner. You feel more tired even after eating, and that's because suddenly your blood sugar went up and now it went back down. You crashed. And now this makes you want to eat more carbs because your body's like, hey, now your like glucose is too little. Like we always want to keep the balance, like homeostasis. Balance is what our body always wants. It doesn't want too much, it doesn't want too little. There's a certain amount that they want. And and they'll do anything in order to like to reach that balance. And so then it's signaling you, hey, like you got to eat something more. And then if you eat like say cookies, snacks, chips, to make up for that, again, your glucose spikes up, and now you're in a bad cycle. You're eating like high carb food, the glucose spikes, and then it crashes, spikes, crashes. And once that's in a repetition, now you're being resistant. Like the insulin resistance is what it develops because, again, our body doesn't like drastic changes. So then it's gonna not want to have those drastic changes, and it wouldn't respond as well as to the insulin. So it's important that we avoid foods that gives us a spike and crash. Instead, there are foods that increases our glucose in more steadily level. And I will go over those in the next slide. So this is a cheat sheet. Again, you know how I said like simple things, like simple foods really spike your glucose. So for example, rice. And even within rice, you know the difference between a brown rice and a white rice? So white rice is when like the outer layer of the brown rice has been peeled. So what does that mean? That means it's been processed more, right? Like the outside layer had to be peeled in order to become the white. So then white rice is what makes your insulin, the glucose spike, and it makes you crash. But then like the brown rice, it's less processed, right? It's more in their natural state, will prevent that. So even within the same category, we don't tell patients to completely like cut it out, but have alternatives. So then the brown rice, what it does is it takes longer for our body to digest it, because instead of like the factory having to peel those layers off, we had to peel it, right? Our body had to peel it. So then it's doing extra work. And because it's doing the extra work, it's preventing that spike up. So for example, brown rice is preferred over white rice, and same thing for bread, like multi-grain bread is preferred over like white bread. And same thing, like oatmeal would be preferred over, again, like white rice or anything white. And then like bananas, peas, edamames, beans, like those more like that didn't go through the factory, Those are like straight from the nature. Those food, it takes longer for our body to process. So anything that hasn't been processed outside, our body has to do the job. That's why it's going to take longer. I think that's like a good way to put it. And that's a good way. The more it is closer to its natural state, the more work that our body has to do, and that's good for us. And then, like Coca-Cola, like candy, donut, that has gone through a lot of factory, right? Like the flour, they had to bake it, put sugar on it. It had a lot of like human effort. And like those food, it's bad for you. Like it's very simple if you're unsure like what's gonna spike your glucose versus what is not. Like these are simple, cake, cookies, chocolate, and some of them, it's not just about sugar, it's about carbohydrate. I think I want to focus on that too, because some patients say, I don't need candy, I don't need like ice cream, I don't need soda. Like, why is my glucose level high? But it could be that maybe all your pasta is like white, all your like rice is white. Those are things to consider. And even fruits, eating them as a whole versus blending it in and making it as a smoothie is also totally different. Because what did I say? The smoothies process, right? The blender did the work for you. So if you drink that, your glucose is gonna spike. But if you eat as a whole, your body is what's like blending it. So then you have less of a glucose spike. And these are some of the healthy swaps that can be made. Some I've already mentioned, but white rice or brown rice, flour tortilla to corn tortilla. Instead of sour cream, can use Greek yogurt. Instead of fruit juice, like fruit water. Instead of like French fries, even maybe like sweet potato fries. Those are some of the alternatives that you can try. And not just the type of food you eat, but the order also matters. And this is something that I found out recently as well. But depending on the order that you eat your food can also make a difference. So, for example, the picture that you see eating the rice, the rice followed by like tuna, followed by avocados, and then broccoli, that's the wrong order. It should be broccoli, followed by avocado, followed by tuna, followed by the rice. And that's because eating vegetables and protein first prevents that glucose spike. Again, it's yeah, the order also matters, and you're not gonna have the reactive hypoglycemia where it spikes up and then it comes down feeling hungry again and eating more. So then, of course, we don't want to eat desserts first, right? Like we don't want to we don't want to eat ice cream or cookies first. Like we want to save those last and eat with our fresh vegetables, steamed vegetables, followed by healthy oil like avocados, and then lean meat um like chicken breast, tuna, and then like rice, pasta, would be the preferred way. So, in summary, we talked about the mechanism of how insulin works in our body, how we digest the food, and insulin brings in the energy source to be used by our cells, our muscles, and the type of diabetes, depending on whether if you don't have insulin production at all, it will be type 1, versus if you do have the insulin, it's just our body's not being able to utilize it, it will be type 2. And some of the symptoms that you would experience with diabetes have being, having to urinate a lot, being thirsty, losing weight even when you don't intend it, having, numbness of your feet and hands, which we call neuropathy, having infections that don't heal as often, and the complications of it if diabetes isn't well controlled with your vision, um, again with retinopathy with your kidneys, nephropathy with kidneys, and increases your risk for cardiovascular disease with heart and strokes with brain, and etc. And there are ways to treat it with insulin, metformin, oral, and injectables, but we want to focus on the lifestyle with exercise and food, because food is something that we eat every day, right? At least 2 or 3 times a day. So then those make more impact if you think about it than the one-time medication that you take. And we want to do everything to prevent that, right? Like if you could not take medications, like wouldn't that be the best? And I think food can make a huge difference, and it's something that is within your control. It's something that you can do at home while you're at work, that you can totally control on your own. And it's hard, but like definitely doable. And we're talking about, you eating complex carbs instead of simple processed carbs. And it's not just about sugar, but again, carbs that you see in everyday food. And even the order of how you eat it can make a difference of eating, vegetables and protein before eating simple carbohydrates. Those are my references, and thank you.
That
Um,
was so great. Thank you so much. Does anyone
Thank
have
you.
questions for?
Yeah, seriously, any questions? Like this is such a small group. I'm open to answer any questions you guys might have.
Hi, thank you so much for this presentation. I'm Charlene.
Hi, Shirley. Nice to meet you.
Okay, and what I will say is I like the points that you made. You showed us the difference so that we can see, but a lot of it, and I think you mentioned it, is lifestyle changes. Adjustment doesn't come quickly. And a lot of the things like I used to use and eat white rice. So then I substitute that for brown rice. But I will tell you, to be very honest, it's not easy.
Right.
Beginning
It's
it
not.
rough. Okay.
Mhm.
These lifestyle changes are rough. So you have to say to yourself, depends on, your age and everything else. Do you want to live a little longer? Do you want to not keep taking these medications?
Mhm.
Because all it does is keep adding, 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 adding. If you were taking two, becomes three, four, So
Right.
definitely the lifestyle is important, and exercise. It doesn't even have to be, the gym. It could
Mhm.
be just something simple.
Yeah.
I enjoyed your points, and I live by a couple of them, and I will share that information with everyone. It is so true.
Thank you. Good to hear. Good to hear that you're like implementing these changes. And it's like one step at a time, you know? Like we're humans. We can't just overnight like do all these things at once. But like even the fact that you're motivated to make these changes, I think it's great.
I just want to say that I really appreciate the presentation, even though I knew a lot about diabetes because my dad was a diabetic and my aunt is, but I learned even some more tonight, and the diagrams explained everything so clearly, especially the vein with the glucose in it, and
Mhm.
so thank you so much. That's all I want to say. Thank you.
Oh, thank you. Thank you, Miss Gilda. Yeah, I
Any
try
other?
to put more like visuals instead of words because I'll be talking and I'm also a visual learner. So like having pictures and having to visualize our body kind of makes it like I think more fun and easier to understand. So
Definitely,
Yeah.
definitely, yeah.
Does anyone else have questions or comments?
She's so good. She answered all our questions.
I do have a question. So, when you mentioned it matters like the order you eat your food, all I kept
Mhm.
thinking was like, I just eat it together. Like, how do you like, you know what I mean? Like,
Yeah. I get what you're
yeah.
saying. So then that would be hard to do, but like what I suggest or what I do for myself is that I would salad first, right? If
Okay.
I can, then I would salad first and like give it a few minutes, you know? Like have our stomach like feel the food, you know? Like vibe with it. Yeah. Let it give some time to like enjoy the salad, like taste the freshness, and then can eat meat or protein of your choice. And it's really hard to eat like one thing at a time because like we
Yeah.
eat it as a mix.
Yeah.
You know, we eat a little bit of each, but even then, eating all three at once would still be preferred over just eating pasta. You
Yeah.
know,
Could
yeah.
you explain why the order matters? I don't think I heard that part.
Okay, so basically, our body is adjusting, right? So instead of having the glucose spike, it's having like a it's buying time by with the veggies and with like protein, it's buying time. So then it's not surprised.
Okay.
Yeah,
I like
basically.
that. I like how you explain it. It's just like,
Yeah,
poof, that makes sense.
yeah, it's
Like when
not
you said
surprised.
about how basically if it's been touched by machines and
Exactly,
people, it's
exactly.
not
It's already
good.
working. Our body's already working. It's already moving. So when like the simple carb comes, it's like, okay, like, you know, I'll work just a little bit more. It's not having to like fully accelerate it from like day one.
Yeah.
Yeah.
Thank you.
Mhm.
Thank you. All right. So this meeting was recorded. So as usual, we'll send it out, in case you guys missed anything or want to review it. We really appreciate you. Thank you so much for coming, and thank you
Yeah,
for
of
just
course.
the way you present. You're very pleasant, so I appreciate that.
Thank you. Thank you for having me. I want to come back.
Great, great.
Yeah.
We'd love to have you back.
Yeah.
I'll let
Invite me,
Cindy
please.
know. I'll let her know.
Okay. All right.
Thank you.
So,
So at this point, we're going to transition and do our raffle. So I'm going to read off the names I have for people who said that they are residents. So if you don't hear your name, please say something because we're going to do the raffle, okay? So I have Gilda, I have Stacy, I have Tanya, I have Lakeisha, Gilbert, and Barry. Did I miss anyone? If I did, please put your name in the chat. And we're going to start. Okay. All right. Let me see something. I'm having trouble sharing. Give me one moment, y'all. Hold on. Okay, Christy, can you see if you can make me a host? I don't know what's going on. It's saying that I can't share now.
Yes. Let me try to do that. Um,
I think I made you a host instead of a co-host by mistake.
Okay, how do I make you a host?
Okay, so if you click on the three dots when you look at my name in the participants.
Oh, I see. Uh-huh.
Mm-hmm.
And then, okay, make host.
Okay, let's see if that worked. Yes,
Okay.
thank you.
Yeah, yeah, yeah.
I gave you all the privileges.
I know you did, and now you're taking it back.
Thank you. All right, so can you all see my screen? I'm gonna blow it up a little bit, so put it in the center. One moment,
Yes.
guys. Okay, thank you. All right. Okay. I don't want to write anything. Hold on one moment. I don't want to notate anything. Don't do that. Okay, cool. All right, so I'm gonna get started with the first person. All right, Tanya, you are a winner. Congratulations.
Thank you.
Congratulations. All
I
right,
enjoyed
Tanya.
the meeting. It was very
Yeah, thank you
informative.
for being here. I'm going to put in um your I'm gonna send you a link.
Okay.
Well, I'm having trouble. Yeah, I don't know what's going on with Zoom. I was gonna try to send it to you directly, but I don't think I can. Give me one moment.
No problem. Wait, I just realized somebody said they're not in the raffle.
Yeah, I'm gonna add. I just saw the person come in. I'm gonna add them.
All right.
Okay, so but Tanya Brooks,
Yeah.
you got that link. You can fill that form out, okay?
Yes.
And I
Thank
see another Tanya came. Let me get that. Okay, guys, bear with me, please. Okay, the other Tanya that came in is Tanya, right? You can announce it, say yes. I think that's what I saw. Yes, Tanya? Tanya? Okay, that's what I'm gonna go with because I'm having trouble seeing. Okay, we're gonna spin again. All right.
I haven't seen my name.
Okay, Tia. Okay, hold on. Okay, so we got Tanya. And I'm gonna add Tia, and I'm gonna ask again before I do it because I see people are now responding. So give me 1 second. So I have Tia, I'm adding Tia. And let me go to the chat. One moment. Okay. All right. Okay, Sade. Do I need to add anyone else? I have Tia and Sade. Anyone else? Okay, so Tanya, Tanya, I'm going to send you the a form for you to fill that out. One moment. Okay. Okay, I found Tanya. Okay, Tanya, I just put the link in the chat for you, and then we're gonna continue. Okay, we got one more. Let's go. All right, our last one is Gilbert. Gilbert, are you here?
Yeah, still here. Enjoyed
Okay,
the meeting.
great.
Very informative.
Great. I'm glad you enjoyed it. So I'm gonna give you the link as well. Those of you who received that link, please fill out the form. That's how we're gonna be able to contact you to actually get your card. It's gonna come to you via email. So let me get yours, Gilbert. Okay. And oops, I didn't mean to do that. We're not counting that one. I didn't mean to do that. Um, so those of you who got the link, please just put in the chat done when you've completed it. And I'm going to go back to my presentation and then we'll wrap up for tonight. Okay. But I'm so glad that you all enjoyed what you heard so far. And we'll just wrap things up for tonight. So I'm going to share my screen again. Okay. Okay, so this is the last slide for our presentation deck, just encouraging you to stay connected with us. We are on Instagram and Facebook. Our handle is East Flatbush Partnership. So sometimes we post events, we post pictures from past events. It's a great way to just stay connected with us. We also have our website, which is eastflatbushpartnership.org. You can find a calendar of all of our events there and different resources. You can always email us at ef@jccany.org if you want to share any information or ask a question. And then you can always call us as well at the 347-675-7810. That is Cindy's direct number. Okay. So we are done for tonight. I'm just going to go to the chat and see if there are any questions. Okay. So Tanya, you said you didn't see the link. I'm going to send it to you again. One moment. Okay. So Tanya, I'm sending it directly to you. Okay. I just sent it again. All right. So I have Tanya Brooks is done and Sade is done. Oh no, Sade didn't do it. Okay. All right, everyone. So I'm just waiting for Tanya Tamya to fill out the form, but we are officially done. I'm going to stop recording. Thank you so much for coming today.